PhantomAR is an extended reality game for alleviating phantom limb pain that is being used at the Biggie Trauma Hospital in Germany.
From my long-term experience with amputation patients, I know that very many of these people suffer from phantom limb pain for a long time.
Phantom limb pain is an excruciating type of pain that occurs in the area of an amputated limb. Phantom limb pain may feel like a burning sensation, a cramp, or an electric shock, and may be felt in the fingers, toes, or the entire arm or leg. The phantom limb may even be experienced as if it is embedded in concrete, twisted, or pricked with needles. It is a very debilitating condition, and patients suffering from phantom limb pain are unable to participate in everyday activities, their lives dominated by the pain.
So at this point in time, treatment of phantom limb pain is primarily based on the application of drugs and also some surgical interventions. However, these do not solve the problem in the majority of patients.
If the patient moves the remaining limb in front of the mirror, the reflection is perceived as movement of the amputated limb by the brain.
PhantomAR is meant to extend the benefits of traditional mirror therapy by performing bimanual tasks using a holographic arm controlled by their residual limb.
Despite our best efforts, phantom limb pain still remains a hard-to-treat entity that causes a great loss of quality of life for these patients, so we are constantly looking for new treatment approaches. We don't have that many options to offer from a surgical standpoint for these patients, so we heavily rely on adjunct therapy to improve quality of life in these patients and reduce their pain and suffering. However, these therapies are not as efficient as well and do not solve the problem completely, so we are more than happy to have a new adjunct and innovative treatment approach as is PhantomAR.
Gamified, extended reality applications are a relatively new method of treatment for phantom limb pain. The idea behind this method is that by engaging the patient in an interactive and immersive experience, the brain receives visual and haptic feedback and the patient will experience less pain. The Play Bionic working group at the Biggie Trauma Hospital, together with the University of Tokyo, aim to develop innovative technological solutions for the treatment of phantom limb pain and to provide them directly to the patients. In PhantomAR, not only can patients use their unaffected arm to interact with the extended environment, but they can also control a virtual hand that is superimposed on their stump via myoelectric electrodes. Therefore, during the first therapy session, the patient's muscle signals from the forearm are recorded and saved in the application. Each recording is uniquely personalized to the individual patient. After the patients have familiarized themselves with this new technology, they can stand up and start exploring. From here on, no further instructions are required. However, like anywhere, first interactions can be tricky, but patients soon are immersed into the game. In contrast to virtual reality, PhantomAR allows patients to see their actual surroundings, while interacting with virtual elements. This helps trick the brain even further into thinking that the patient's limb is genuinely interacting with the real environment, and may reduce the perception of pain. The goal is for patients to become fully engrossed in their curiosity and exploration of the virtual environment, to the point that they no longer feel any pain during the game, and ideally afterwards. In PhantomAR, patients are encouraged to explore their surroundings to find ample opportunities for interaction. They can grab virtual objects, resize them, and explore various game mechanics. PhantomAR is curiosity-driven. There is no overarching goal for the patients to achieve. Instead, we wanted to motivate the users to freely explore their surroundings and encourage exploration of the various interactive elements present in their environment.
Our lab is applying various extended reality technologies to enhance human capabilities. One of the target applications of our research is upper limb rehabilitation. We're expecting that the immersion and illusion the technology provides help patients maintain high motivation for rehabilitation.
PhantomAR is designed to be used in any environment, any room, as it uses scene understanding to adapt to the patient's surroundings. The technology detects walls, ceilings, and floors, and uses this information to place virtual game elements in a way that provides a unique and fresh experience each time. This means that no matter where the patient is, they can enjoy an immersive and engaging virtual experience that is tailored to their surroundings. Unlike traditional games, there is no overall goal to achieve in PhantomAR. Instead, it encourages patients to explore and interact with their environment, providing biofeedback to the brain through the use of their holographic hand in conjunction with their real hand. Patients should enjoy themselves, so we took care to include engaging and surprising elements to discover. Virtual balls can be balanced between both hands and bounced off the floor. We also included cute game elements that might follow the player around. We believe that this attention to detail will help create a fun experience for patients and will also aid in their distraction from any phantom pain they may be feeling. Primarily, PhantomAR is a therapeutic tool that can be monitored by a healthcare professional, but in a standalone game mode, the patient is in full control, making it a truly self-directed experience. The setup of the game is fast and easy, with a quick in-game calibration process that lets the patient start playing right away. We aim to find easy-to-use solutions for complicated problems like the calibration of the arm position. While looking at the electrode armband, a simple tap can be used by the patient to calibrate the position of the virtual arm. This is important in giving the patient the feeling that the virtual arm they control is truly their own. Having access to a virtual human arm may potentially be important for amputees to improve their body image. If we take it a step further, seeing a virtual human arm that resembles their pre-amputation appearance could even provide a sense of familiarity and comfort. However, does it really need to be an anthropomorphic representation? Controlling something else, a water hose, a wand, or well, why not a tentacle? It may provide a unique and engaging experience that helps to distract from the pain, or B, maybe the brain just doesn't care at all. There is voluntary movement happening. The patient is actively controlling something. And with that feedback, the brain is happy and reduces the phantom pain. As an additional element, the game provides the option to switch between a human arm or a tentacle. For most patients, this increases immersion and fun in the aquatic level. But the goal is also to disentangle if the ability to move their limb again or the visual appearance of their natural human arm is more important in reducing their phantom pain. By controlling the tentacle instead of a human arm, patients can learn that they don't need an intact human arm for their own body image. This can potentially alleviate the suffering from an incoherent body image when they look at their stump. As part of our clinical study, after each session, we conduct a survey to gather information about the patient's pain sensations. We ask questions about the intensity and quality of the patient's pain and whether they experienced any pain during the session. This information helps us evaluate the effectiveness of PhantomAR in reducing pain and improving patient outcomes.
Wie hat Ihnen das Rohrlevel gefallen?
Hat mir sehr gut gefallen. Passt ja auch zu meinem Beruf, bin Gas-Wasser-Installateur. Deshalb war es ganz witzig.
Ja, super. Und könnten Sie sich vorstellen, PhantomAR auch zu Hause auszuprobieren oder zu benutzen, so wie die Spiegeltherapie auch?
Ja, könnte ich mir ganz gut vorstellen sogar. Ja.
Super,
Mhm.
danke.